Gynecomastia, which is commonly called as man boobs, is quite a common disorder, and it is basically development of female-like breasts in a male patient. The disorder itself is very distressing to the patient because they cannot go out without clothes, and that is why many patients come to plastic surgeons for correction of gynecomastia. There are multiple causes of gynecomastia. It may be physiological or developmental, commonly seen in the infancy, adolescent age group, and then in the old age. There are some diseases which might be linked to gynecomastia, like chronic kidney disease, any liver diseases, hormonal imbalances, diseases which cause hormonal imbalances, like decrease in the testosterone levels, increase in the female hormone, which is estrogen levels. Also, there are some drugs which cause gynecomastia. The most commonly seen nowadays is use of steroids for bodybuilding purposes. There are various other drugs like diuretics, antibiotics, antacids, which cause gynecomastia. Investigation wise, you do not require many investigations to be done in a patient of gynecomastia. The most important investigation in gynecomastia is physical examination and a detailed history. Depending on that, your doctor may advise you to undergo a few other tests, blood tests, which might involve a hormonal profile, which also includes checking your thyroid levels, the male hormone testosterone levels, and the female hormone estrogen levels. Apart from that, not many tests are required. The treatment of gynecomastia in early stages is just conservative. So if the duration of gynecomastia is less than 2 years, I do reassure the patients that this can go off on its own, especially in adolescent age group. Those coming into the teenage, they have gynecomastia and it does settle on its own. However, if the duration is more than 2 years, then you do require surgical correction in these cases. Most of the cases which are small to medium sized breasts are generally treated with liposuction. Liposuction is basically a technology in which you inject some fluid into the tissue which is to be removed, and then you break the septae using a cannula, and then you suck out the fat. So this is how the breasts, you get a reduction in size of the breast, and the skin over it also contracts over the period of time. However, in some cases which have really large size breasts, they might require removal of the breast, which involves a bigger scar and mastectomy for removal of the entire breast. Recovery from liposuction for gynecomastia is it's not a tedious recovery. It's a small procedure, so generally patients can be discharged on the second day, and maybe they have to wear a pressure garment for 6 weeks, and they can start working in maybe 4 to 5 days.